Right.
Hi guys. So today we're going to be talking about Colorado tick fever. Before we begin, I just kind of wanted to explain why I chose this particular disease. Being from the deep East Texas area, we are pretty familiar with ticks. So I was curious to see the relationship between the ticks that we have here in Texas and the ticks that are in the western United States. The other reason that I chose this particular disease is, as a nurse, I find it important to know the type of pathogens and bacteria that we may encounter in the hospital. If we come across classic signs and symptoms, it would be helpful to know exactly what you're looking at. So before we begin, you need to really understand what a tick is to actually get the full effect of this particular disease. So over here on my screen, I have got a picture of a tick, and a tick is defined as a small brownish colored parasite, and they are mostly found in wooded areas and tall fields of grass. They survive off the blood of small animals and humans. Unfortunately, ticks are often carriers of disease that they pass on to humans whenever they bite. So the particular tick that we're going to be talking about today is located in areas of Canada and the western United States. So on my screen here, the yellow area is where these particular ticks would be found. Okay. Most of the cases are reported from Colorado. About 90% of Colorado tick fever is actually out of Colorado. So whenever the weather starts to get nice and warm between February and October, the tick activity really picks up. So Colorado tick fever is rampant between February and October, with about 90% of the cases occurring between April and June. So just a little bit about ticks. If you do get bit, they're going to go for a warm, moist area of the body. There's three major regions that ticks like to go for. The first region is going to be an armpit. The second is going to be the hairline, or the nape of the neck. And then the third region is going to be your groin area. So Colorado tick fever is a viral infection that is transmitted through a bite from a wood tick. The disease is often caused by the bacteria Rickettsia, and this bacteria is gram-stain negative. It's an anaerobic cocci bacilli that lives in a eukaryotic cell. So the only way that this particular bacteria can survive is if it's in a eukaryotic cell. In order for you to receive the infection, you actually have to be bit by a tick that is actually infected with this particular bacteria. So if you were to get bit by just a regular tick, more than likely you're not going to have this particular disease. It's going to have to be by a tick that actually has the certain bacteria. So classic signs and symptoms of Colorado tick fever: you're going to have a headache, chills, fever up to 105 degrees. You're going to be really sensitive to light, just generally not feel good. You're going to be nauseous, maybe vomiting, weak. You may have a faint rash, and your muscles are probably going to ache. More cases than not, this disease is pretty mild. Normally people don't have any major complications from it. On some cases, though, people do have to be hospitalized. This particular disease could cause encephalitis, meningitis, and it could cause hemorrhagic fever. So if you do contact a tick bite and it does lead to this, you're going to be looking at a hospital stay. So in the hospital, there's a couple of things that we can do. We can give you IV antibiotics to help with the infection. We can give you IV antibiotics, IV fluids, and you're also probably going to be getting steroids to overcome this. So let's talk about how we can diagnose this disease. There are several blood-based type tests that we can do. The first one is going to be a complement fixation antibiotic test. This is going to, let us know if you have any antibodies that could throw a red flag to Colorado tick fever. The next one is a CBC. It's going to let us look at your white blood count, red blood count, platelet count to see if you have any inflammation of those. A liver function test is going to let us know if your liver is functioning. Most times with Colorado tick fever, your liver function is impaired, so this may be a sign of the disease. The doctors may also perform an MRI, a CAT scan, a lumbar puncture, and they may go ahead and take some blood cultures just to see what's going on. The only 100% sure way of diagnosing Colorado tick fever is running a PCP, which is a polymer chain reaction. This is a typical blood scan, and it lets us know for sure if you have this disease or not. So let's talk about prevention. One way that you can prevent you from getting Colorado tick fever is, one, know the area that you're going into. If you're going into an area that is known for ticks, you want to be on the lookout for any tick activity. Two is you need to dress appropriately. Instead of wearing sandals and shorts and little tank tops, you need to wear boots, preferably, long socks, pants, and a long sleeve shirt. You want to keep any exposed skin covered so that you don't attract these ticks to come to you. And the third way of prevention is just always check yourself whenever you get back from an area that you know that there are ticks. Look at your children, look at your animals, check yourself out in the mirror. Look at the 3 major regions that we talked about earlier. If you do happen to find a tick, you want to remove it as quickly as you can. Get some tweezers, go to the very bottom part of the skin, as close to the skin as you can, and you're going to want to pull that tick out of your skin. That's going to help, reduce any infection, and it's going to keep you probably from getting Colorado tick fever. But if you do happen to get a tick bite, it's always best to follow up with your medical doctor just to kind of keep them in the loop and keep them watching out for you. So let's say you do get Colorado tick fever. Besides the treatments that we talked about earlier with the hospitalization, there's really no treatments except supportive. This would be given Tylenol for the muscle aches and the fever, given anti-nausea medicine for the nausea, wearing sunglasses to keep the light sensitivity from bothering you. Really, rest and hydration is the best treatment for this particular disease. So always, like I mentioned earlier, if you do get bitten by a tick, you always want to follow up with your doctor. If you display any classic signs and symptoms of Colorado tick fever after you get bit, you are going to want to seek medical attention. And then if you go to remove the tick from your skin and it somehow doesn't all of it come out, you want to go to the doctor immediately to get help. Okay, so a little known fact, a good fact about this, if you do have Colorado tick fever, you do not want to donate any blood for 6 months after your illness. So no blood donations, no bone marrow transplants for 6 months after. The virus actually lives in your red blood cells, and if we take your blood and give it to somebody else, we could ultimately transfer the Colorado tick fever to the person, and that's not a good thing. So no blood transfusions, or blood donations, or bone marrow transplants. Okay, and just a little recap, wrapping it up. With Colorado tick fever, you always want to protect yourself. So know your environment, dress appropriately, and check yourself, your children, and your pets when you get home. You always want to remove a tick. If you find one on your skin, get it out of there as quickly as possible. And then you want to pay attention, note any signs or symptoms of Colorado tick fever, seek a medical attention immediately. Just try not to delay that. And then rest and stay hydrated. And that's pretty much Colorado tick fever.